Assalamu alaikum to all. Hope you all are fine and under the blessings of Allah. Today is the topic androgens and anti-androgens from your chapter of the endocrinology. I'm Dr. Mubasherah Jamil, Independent University Hospital. So what are androgens? Androgens are the group of steroid hormones that have some anabolic or masculinizing effect in both males and females. In males and in females, the major hormone is the testosterone, and in males it is synthesized from the Leydig cells in the testes, and in female it is synthesized in the thecal cells in the ovaries. And in both sexes, adrenal gland is the common organ for its secretion. In this figure you can see how these hormones are secreted and regulated. So starting from the above, you can see hypothalamus, pituitary, testicular axis. The production of testosterone by the testes is controlled by pituitary gland. Then there are two other hormones, FSH and LH. Both of these hormones regulate the synthesis. FSH acts on the testes and LH acts on the Leydig cells. Testosterone stimulates cells in the testes to produce sperms. The major function of the testosterone is beard, body hair growth, promotes the growth of the prostate gland, contributes to the male sexuality, and also causes bone and muscle growth. Sex hormones produced by the gonads are necessary for conception, embryonic maturation, development of the primary and secondary sexual characteristics at puberty. So up till now, what I have told you guys, we are talking about androgens. Androgens are hormones which are produced in both male and female. The major androgen is natural. Androgen is testosterone. Testosterone is produced both in males and females, but in males much more higher concentration than females. In males it is secreted from the testes, and in females it is secreted in smaller amounts from the ovaries. Now we will classify androgens: natural, synthetic, anabolic. The natural androgens are testosterone, DHEA produced by adrenal gland, and androstenedione. The synthetic formulations are methyl testosterone and fluoxymesterone. The names of the anabolic steroids are oxandrolone, stanozolol. The synthetic preparations of the testosterone, they are used both in IM and in subcutaneous form, in depot form, oral. Some formulations are oral. And the use of testosterone is in females is for the breast cancer, and the name of the formulation is Testolec. While we talk about the androgen antagonist or anti-androgens, we classify them as the receptor inhibitors, steroid synthesis inhibitors, and 5-alpha reductase inhibitors. Under receptor inhibitors, we have two, flutamide and cyprotrione. Under steroid synthesis inhibitors are two, again, ketoconazole, which is also an antifungal, and spironolactone, which you also read about in aldosterone antagonist. Then the third form is 5-alpha reductase inhibitor, and under this heading comes the major drug finasteride, and this drug is most commonly used to treat male pattern alopecia. The source of androgen synthesis in adult male is the principal testis. 1,2-testosterone is synthesized by Leydig cells located in the interstitial spaces between the seminiferous tubules. Now, this hormone, testosterone, have both local or direct effect on the tubules, plus it has very important physiological effects on males. As you all know that testosterone is responsible for puberty changes for secondary male characteristics. When we talk about its synthesis, we see how it is synthesized. Starting from the above, from acetate comes cholesterol, and from cholesterol the pregnenolone is synthesized. This is then converted into 17-hydroxypregnenolone. It is then converted into male androgens DHEA, dehydroepiandrosterone. Then it is converted into androstenedione, and finally testosterone is synthesized. Now this synthesis is regulated again by hypothalamic pituitary testicular axis. The number of the Leydig cells are regulated by two hormones, LH and FSH, and the amount of the testosterone is under the control of LH, which regulates the expression of an enzyme 17-beta-hydroxysteroid dehydrogenase. What happens when testosterone levels are low? A hormone named gonadotropin releasing hormone is released by hypothalamus. Which hormone? GnRH, gonadotropin releasing hormone. From where it is released? Hypothalamus. This in turn stimulates pituitary gland. Then pituitary gland in return releases two other hormones, follicular stimulating hormone FSH and luteinizing hormone LH. Both of these two hormones then in return stimulate the testis to make testosterone. Finally, as the testosterone level increases, then it creates a negative feedback loop on the hypothalamus and pituitary, which ultimately inhibit the release of GnRH and FSH-LH respectively. Simple. The regulation is by hypothalamic pituitary testicular axis. Luteinizing hormone stimulates testosterone. Follicular stimulating acts primarily on the Sertoli cells to increase the synthesis of androgen binding protein. So one of the hormones stimulates testosterone and the other hormone affects androgen binding protein. Then this protein bind with the testosterone and it facilitates the transport into the seminiferous tubules for further generation of sperms. In this figure you can see anterior pituitary. Anterior pituitary is secreting LH and FSH. So the LH is responsible for the Leydig cells and FSH is responsible for the androgen binding protein to facilitate its transport, testosterone transport. This is the same figure you can see. Again, this is showing the hypothalamic pituitary testicular axis. How it is distributed? The plasma protein binding of the testosterone is 98 to 98.5% with 1.5 or 2% free or unbound. How much it is? Free only 1.5 to 2%. 65% it is bound to sex hormone binding globulin and 33% it is bound weakly to albumin. So before in corticosteroid Glucocorticoids, you read about the binding globulin, corticosteroid binding globulin, and here you are reading sex hormone binding globulin, right? About metabolism, both of the hormones testosterone and 5-alpha dihydroxytestosterone are metabolized mainly in the liver. And after metabolism, 50% of the testosterone is metabolized via conjugation into testosterone glucuronide and testosterone sulfate by glucuronyl transferase and sulfotransferases respectively. So here you can recall phase 2 reaction, glucuronide conjugation. So the metabolism of the testosterone is by phase 2 reaction. 40% of the testosterone is metabolized in equal proportions into 17 ketosteroids, androsterone, and ethioquinolone via combined actions of 5-alpha and 5-beta reductases. So under the heading of metabolism, you will write how it is metabolized, where it is metabolized, and the names of the enzymes and the names of the compound after glucuronide conjugation. In this flowchart, you can see which product is formed from which product, cholesterol, pregnenolone. Then comes two things, progesterone and DHEA. DHEA is converted into androstenedione and androstenediol. Both of them are being converted into testosterone, and then testosterone also produces estradiol or estriol, and with the help of an enzyme 5-alpha reductase, testosterone is also converted into dihydrotestosterone. So you can see there are several steps from the cholesterol, and it is converted into the liver in inactive metabolites. After binding, it exerts its action and it causes the activation of androgen receptor. Normally, the levels of testosterone are about 7 to 8 times great in males as compared to females. As the metabolism of the males is greater, so daily secretion of the testosterone is 20 times more in men than in women. In addition to its natural role as a natural hormone, testosterone is used as a medication in the treatment of low testosterone levels in men and in breast cancer in women. Here you can see the targets of the testosterone. It is divided into three things: for external genitalia, for internal genitalia, and for the bones. So here you can see what testosterone do to external genitalia, maturation. What it causes to internal genitalia, again maturation. And an important effect on hair follicles is increased growth during puberty. An important effect on skeletal muscle mass is increased mass and strength during puberty. And what it causes in bones? Epiphyseal closure, increased density. Now we will come to the pharmacodynamics and mechanism of action. So androgens bind to a specific nuclear receptor in a target cell. It is the active ligand in both muscle and liver, and it is metabolized by an enzyme named 5-alpha reductase 2 dihydroxytestosterone. Then testosterone is biotransformed to estradiol by another enzyme, cytochrome P450 system aromatase. The hormone receptor complex then binds to DNA and stimulate the synthesis of specific RNAs and proteins. So it's clear guys, the mechanism of action, as you all know, in muscles, its testosterone is the active ligand in the muscle and liver. It is metabolized by an enzyme to DHT, and with the help of another enzyme, cytochrome P450 aromatase, it is converted into estrogen. What is the importance of androgens? There are many uses of androgens. For example, the first and major use is in male, where the natural testosterone is deficient or not produced. So, it is used as a replacement therapy in men, in hypogonadism, in impotency, in decreased libido, in aging, and in infertility. Sometimes in certain kinds of anemia like aplastic, leukemia, lymphoma, it is largely replaced by recombinant erythropoietin. Then there is another use in osteoporosis, either alone or in conjunction with other estrogens, for example, replaced by bisphosphonates. Then there is another condition, angioneurotic edema. The preparation used is danazole. It's the name of the drug. Finally, in the female, it is used in endometriosis and fibrocystic disease of the breast. Again, the name of the drug is danazole. Androgenic effects. Androgenic steroids are used for males with inadequate androgenic secretion, hypogonadism. Some of the anabolic effects of androgens are used to treat senile osteoporosis and chronic wasting associated with certain conditions like cancer, like HIV, like chronic illness, and it is also used in severe burns and in chronic diseases, in debilitating diseases, or to speed up the recovery from surgery. The endometriosis, it's a certain disease in females in which a male androgen danazole is used. It also possesses anti-estrogenic activity as well. It inhibits the release of FSH and LH. But because of its many adverse effects, danazole is now not frequently used. The adverse effects were weight gain, acne, deepening voice, and increased hair growth. Many of the men try to use it for making muscle mass. So this use is declared as unapproved. Anabolic steroids are not supposed to use to increase the lean body, muscle mass, muscle strength, or endurance in athletes. So this is not a recommended use. There are certain adverse effects as well in females, in males, and in children. What are the adverse effects in females? Of course, if you are giving a male testosterone, it will cause masculinization, acne, growth of facial hair, deepening of the voice, male pattern baldness, excessive muscle development, and menstrual irregularities. In males, if you are giving excessive androgens or the body is producing excessive androgens, it can cause impotence, decreased spermatogenesis, and growth of the prostate gland. In children, androgen can cause abnormal sexual maturation and growth disturbances. Another profound effect is on serum LDL and lower serum HDL. It increases the LDL and it lowers the HDL, means it decreases the good cholesterol. Sometimes androgens can cause fluid retention as well, leading to. Now here up till now we ended with the androgens. Now we will talk about the anti-androgens and why we are talking about anti-androgens in certain conditions where excessive androgens are produced in the body. So what are the anti-androgens? Here we can see in this figure: ketoconazole, spironolactone, finasteride, flutamide, cyproterone, and in this figure you can see there are different levels where they are reducing the synthesis of testosterone. Anti-androgens, what they do, they counter male hormonal action by interfering either with the synthesis of androgens or by blocking the receptors of the androgens. At high doses, this ketoconazole, which as you all know is an antifungal, inhibits several of the cytochrome P450 enzymes involved in the steroid synthesis. Here you can see the chemical composition or formula of various androgens antagonist. So we will classify, as we read earlier as well, receptor inhibitors, steroid synthesis inhibitors, and 5-alpha reductase inhibitors. Further we will read about them. Finasteride and dutasteride are used for the treatment of BPH, benign prostatic hypertrophy. They are synthesis inhibitor, so they inhibit an enzyme 5-alpha reductase. By inhibiting this enzyme, there is decreased formation of DHT in the prostate, which leads to reduction in prostate size. Flutamide acts as a competitive inhibitor of androgens at the target cells. Flutamide is also used in the treatment of BPH. Another two drugs are bicalutamide and nelutamide. They both are effective for prostate cancer. So, the major indication of flutamide is metastatic carcinoma of the prostate. And what is the mechanism of action? It is a non-steroidal anti-androgen inhibitor which inhibits the cellular uptake of androgen steroids, and it also inhibits nuclear binding of androgens to their receptors. The metabolism: adrenal hepatic metabolism, excretion, renal excretion, binding 96% protein bound. It is used in conjunction with LHRH or GnRH agonist. Few of the adverse effects are photosensitivity or urine color change. Another synthesis inhibitor is cyproterone acetate. It acts as anti-androgenic and works best in women with hirsutism and hair loss. So what is hirsutism? Male characteristics in females. It blocks the androgen receptor in the follicles from binding with DHT. Administering estrogen therapy may be necessary in conjunction with cyproterone acetate. Means, if you are giving cyproterone, it's better if you give estrogen as well. And what is its major use? Major use in women with hirsutism and hair loss. Talking about its side effect, its side effects are same as spironolactone does when used in men. Major toxicity is liver toxicity. Now the synthesis inhibitor is ketoconazole, which is also antifungal. It inhibits the cytochrome P450 enzymes in adrenal gland, but it is not used in females suffering from increased androgens. And not much use is promised in prostatic hypertrophy. Now another drug is 5-alpha reductase inhibitor. The name is finasteride. You may be familiar with this name as this drug is used very commonly for male pattern alopecia. So in males it is given for prostatic cancer or BPH, and in females usually it is given for hirsutism and alopecia. Alopecia is the name of the drug. Side effects are of course all anti-androgenic type of side effects. In males it can cause erectile dysfunction. In male and female both it can cause hepatitis, and in young pregnant women it can cause teratogenesis. While we talk about finasteride, its major use is in hair loss. Why? Because usually hair loss is believed to be androgen dependent. Male pattern baldness is triggered by the buildup of the DHT in the hair follicle in the scalp. What is DHT? It is a derivative of testosterone. So, by giving several anti-androgenic therapies, we are counteracting DHT, which is responsible for hair loss in both men and women. The last drug is nalutamide, and its indications are in the treatment with surgical castration for metastatic carcinoma of the, again, prostate gland. Mechanism of action, it's a non-steroidal anti-androgen. And what does it do? It inhibits cellular uptake of testosterone, and also it inhibits nuclear binding to its receptor adrenal gland. It also inhibits a variety of cytochrome P450 enzymes. By this slide, we ended with the androgens as well. So when we sum up what we read about everything about androgens, there are synthetic androgens and there is natural androgen. Natural androgen is testosterone. Testosterone is produced both in males and females, but of course more amount in males and lesser amount in females. Then we read about its androgens, anti-androgens. Why we are giving anti-androgens? If we are facing the excessive amount of androgens, we will give anti-androgens. And the major use of one of the anti-androgen is finasteride is for hair loss.